So hi everybody, we're back.
Hey, we are excited. It took a little bit to get here with some family stuff going on.
Yes. Everybody has family stuff, but yeah, sometimes it hits harder than other times. But
Yes.
everybody seems to be doing well at the moment, so we can record some more for you guys.
We have a very special guest.
Yes, well, depending on when you watch this episode, we might be dating it by what I'm going to say, but it's almost Easter. Easter for us at this point is next weekend, I believe.
Yes.
And so I was just in the store, and I have two pups. And, of course, I went to, I'm not advertising, but Target, and they have that $1 section, or the $2 section when you walk in. And so I got these cute little bunny ears.
Love them.
For like $1. And so I thought, let's get some ears going
Happy
here.
Easter.
So,
This little girl wants to
but
say
the
Happy
reason I
Easter.
really got these ears, you guys, is because of this little. We have two of these little things.
Oh, we put on your ears. Oh my goodness, you are so cute.
Put it up here.
Oh.
My big old ears. There you go. How cute you are. Look.
Oh. So adorable.
So this is Piper.
Yes, you are so cute. Oh my goodness.
And so, of course, I'm going to use the ears for like a photo shoot with these two characters. I have one more of these French bulldogs.
Look at this face. So cute. Oh my
Yes.
goodness.
You're not our guest today, though. Just your temporary quick guest. Thank you, Piper.
So cute. Love it.
Oh, man.
Okay.
But seriously, today we have a pretty good topic. I think,
Yes.
We work a lot with students, and I think students kind of ask this question sometimes about whether to do a residency or do they go straight out and look for a job.
Right.
And as I'm an older pharmacist, and as a lot of my friends who went to school and just got their PharmD want to take a different path.
Right.
Sometimes I get asked, gosh, I'm thinking about doing a residency. I'm thinking about getting board certified. Should I do that? I'm in MTM, so there's a lot of talk about the MTM certificates and certifications that are out there. So we thought we would have a talk on just talking about those certificates and the opportunities to expand your learning, and like, when are they important? Are they important? Should you get one? So we thought maybe we'd talk about that a little bit.
Love it. Let's do it.
So I think the first big one that everyone talks about is residency, because we think about that when you first get out of school, you can do a residency. And so I was thinking, like, when people we knew who graduated school, so whether you need a residency or not, let's think about where you want to go in your career, and is that residency going to help you? So I thought, let's start by thinking about who did we know that did a residency, and like, what are their jobs now, because that would help us think about that.
Right. So a lot of my friends either went to like the VA, or if they did a residency, now they're into hospital or even administration within the hospitals. Right. So that's kind of where I see those being very useful in creating connections and kind of, I guess, almost creating like that discipline, further research, presenting, learning the ropes of how the hospital or the VA system works.
Right. Because most of the residencies are in a hospital environment. And so I agree. I think a hospital, if you don't have to have a residency to necessarily maybe work, I don't think, in a staff pharmacist kind of position.
Right.
I know staff pharmacists in hospitals that do not have a residency. But I think if you want to be more of the clinical pharmacist and round with doctors and kind of be part of the medical team, or administration, I think you're exactly right. That's the people I think of. Other people we talked about was academia. Like, if you want to go into academia or teaching, a lot of times those positions require a residency.
True.
To do that. Because in the residency, what you get out of a residency is some people I know who did a residency out of school felt like, I'm just not ready to be a pharmacist yet. Like, I really wish I had one more year to train.
Yeah. Oh,
so
yeah. There's a lot thrown at you.
Yeah. So that one more year is like a big rotation that gets you into the hospital, kind of working in different areas of the hospital with the team. And to me, it's like an extra year of kind of clinical experience. So some people do it for that reason. You're going to get that out of it for sure. Also, in a residency, you get to teach. So usually there's rotation students also at the hospital, and your preceptor of your residency will oftentimes give you a portion of the teaching of those students. So you oftentimes have to do presentations to the students and kind of help grade their work or make sure they're staying on track or do those clinical pearls with them, be a teacher to those students. And not only presentations to them, you will also be doing presentations usually to the staff.
Right, educating doctors, nurses, different wings.
So if you're interested in kind of that kind of experience, that's a good one for residency, just doing more presentations to students and people. Also, you work with patients. You're going to have some portion of your residency is staffing. And of course, you're going to actually be acting as a clinical pharmacist. And then also, you are going to do research project. Most residencies, PGY ones, want you to do some kind of residency project. And you have to do it kind of quick. You have to decide pretty quick because you only have a year to do it. And they usually want you to publish afterwards. So another neat thing of a residency is you will either get to publish on your own, but most likely it's with your preceptor. They'll kind of bring you into a project and help you write something on it. So that's really cool. You'll get to publish, hopefully. And another way I think that a residency is helpful is if you want to do a PGY too. So if you want to go on and become, usually your first residency year, if you do 1 year, is very general.
Okay.
And your second residency year is when you would get to specialize, say in oncology or pediatrics or pharmacogenomics or, some kind of unique specialty. So if you want to have a specialty, it might be a good idea also to have a residency.
Cool.
So those are just some things to think about as you think about would a residency be important. So in your job career, I think you have to kind of weigh out, is that good for your job? Like if you're just trying to move up in an organization, maybe even in the community pharmacy, then maybe a residency might not be. Right. It would be great to do as a learning experience, but it might not get you where you want to be.
True.
In job-wise. So one other thing I wanted to talk about that a lot of students don't think about and many pharmacists don't really think about or know about is what's called a fellowship. And so I wanted to briefly talk about what's the difference between residency and fellowship. So a fellowship is usually for 2 years, where a residency is usually for 1 year, per PGY1, PGY2, each of those is 1 year. And you don't have to do the second year. But a fellowship usually is for 2 whole years because it is really focused on research. So if you are interested in research, you're going to get 2 years to do a very comprehensive research project.
Interesting.
And it's usually very intensive compared to like the project you would do on a PGY1. It's really research based. You're definitely going to publish probably more than one publication. And that is really good for anyone who's interested in things like doing research for industry.
Okay.
Or I know one person who did a 2-year fellowship, and it was to really go into more of policy, actually, like policy or even quality, kind of deep statistical things.
Okay.
Or policy type things. That might be good to do a fellowship. So I would just say, if you're interested in those things, maybe talk to people who are doing those things and see if they would suggest a fellowship. But those are really helpful in a statistical research kind of way.
Nice.
Yeah. And so some people, the next topic we want to talk about is their certificates. So there's lots of different certificates out there. Which ones do you know about?
I was thinking of like a lot of people in the VA will go on to get like board certified in something to kind of get more specialized so they can kind of study on their own, take the test. It's a lot of work.
So board certifications are definitely something that's kind of similar to a residency, but not. Okay. So actually a board certification, really funny story, guys. There's the squirrel climbing on the window right outside. Oh, he fell. He's trying to be part of our podcast. There he is again.
Oh, wow.
He's eating out of my bird feeder outside the window. He's loving getting all the corn out of my bird feeder.
He's dangling by his 2 feet.
I don't know if we can move the camera and show you guys.
Really impressive.
Let's see. I'm gonna try. So forgive us. We're gonna move the camera. See, there's the squirrel.
And he was dangling by his feet, like while he was eating with his front paws.
There he goes. Oh, there's another one. Oh, so we have multiple squirrels. I have a squirrel infestation on my bird feeder. Intermission.
Okay, we're back.
It's real, folks. These are real recordings.
Yes.
So let's talk about board certifications. I'm going to move our camera back over here now. So that is another way. I have to say, when I went into a position that you would normally have a residency in, since I didn't have the residency, I got a board certification to kind of trump the fact that I didn't have a residency.
Okay.
So instead of completing a residency, I decided to test for board certification. So the board certifications, the most nationally regarded and respected board certifications fall under what's called BPS, the Board of Professional Specialties or Pharmacy Specialties, BPS. If you Google it, you'll find it. But there's different specialties you can basically study for, take a very comprehensive test, and get that certificate. And there are subjects like oncology. There's very specific ones you have to look at the list. But there are general ones. So a lot of people get the general pharmacy specialty, which is the BCPS. And then another very popular one is the BCACP, which is the board certified ambulatory care. So you've kind of got the pharmacy specialist and the ambulatory care specialist. And it is just like it sounds. The pharmacy specialist is more of like inpatient.
Okay.
So the questions on that are going to be very much about IV dosing and drips and stuff like that. TPNs, yes.
Okay.
That's the pharmacy specialty one. So if you're in a hospital and maybe looking for a way to kind of expand your knowledge and your cred, is to maybe get a BCPS. That was not my world, so that wouldn't have worked or would have been very difficult for me to have tested into. So the ambulatory care one is available now, which is definitely more of an ambulatory care subject, which is more of like the walking around meds that we're all used to, high cholesterol, diabetes. So it's all of these subjects, and MTM is one of those subjects that fall within the BCACP that you would study and have to test into. So it's this huge test, and the statistics are really hard to pass. So some people takes a couple of times. A lot of people, it takes a couple of times to take that test and pass. That's how intensive it is. You have to really study and know the guidelines and know the therapies for pretty much most of the disease states. It's very intensive. You can take courses that help you study for it. There are books that you can study for it. But it is definitely, when you finish and you pass that test, that's the smartest I think I've ever been in my life. The most stressed, maybe, close to the most stressed, and also the most knowledgeable. So I got my BCACP, the ambulatory care specialist, because it was, studying for it was actually fun for me because I learned a lot of, just clarified all the guidelines, clarified the new meds. How do you use them? When do you use them? What are the side effects? Like, it just really got you into the details again, almost like school. But you can't do a BPS, you can't do a board certification unless you've been in practice, I think is for 4 years.
I was going to say, I don't know any recent grads that actually do that. Okay, so 4
you
years.
have to have 4 years of practice. So it is something you would do later on.
Interesting.
They want you to kind of go out and be a practicing pharmacist before you get the specialty. The one trick is if you do get a residency, the residencies cut out a couple of those years, I think. So if you do a residency, it takes off a couple of those years of having to be in practice. So I think it's you have to look into it, but I'm pretty sure that after your residency, you're really close to being able to test.
Oh, nice.
For the board certification. So those board certifications, you get to actually put letters after your name. So that's when you see people with like multiple letters after their name, like BCPS or BCACP. Those are board certifications. Anything that starts with a B is usually board certification. Okay. So that's kind of cool. You get to put that after your name. It gives you cred. It gives you... People know those tests are hard, and they know that if you were able to pass that test, then you must know a lot about a lot, and you do. And then you have to maintain that, so it's good for 7 years, and then you have to take 100 CEs. Well, you can retest in 7 years, which I would not do. It was so hard. But you can, in lieu of that, you can take specific CEs. There are specific CEs you can take. You have to take 100 CEs over that 7 years, and they're very specific, and they're very hard CEs too. But I'd much rather do the CEs than the test again. So, but then you can just every 7 years renew and maintain that. So it's pretty, and it keeps you smart, keeps you up to date on stuff.
There's so many new things that are happening, new guidelines. So that's probably perfect to like have that motivation or that accountability to like study. Like, you work this hard to get your letters, like keep them after there.
Keep them. And so I think where that would become helpful is if you want to be seen as the specialist in that area, especially like, well, in academia, there's the certified diabetic educator.
Oh, right.
Right. So A lot of people have the CDE, which is a certified diabetic educator. And that, again, is a hard test you have to pass. And those people, to me, know everything there is to know about diabetes. They're the people you go to who know everything about diabetes. So if you want to become that person,
person.
Yeah. And like in academia, the people who teach diabetes in the universities, of course, they are usually certified diabetic educators. So you would want to be, if you're trying to put yourself into a box that is like, I'm a specialist at ambulatory care, or I'm a hospital specialist, those are the good things to get.
Okay.
So it kind of sets you apart in a big way, and it's a very respectable thing to have, is those letters after your name. I think if you want to be in leadership, that says a lot about, you running a clinic is going to look good if you know that you're a specialist in that kind of area for running like a special clinic. Trying to think anything else. Also, I think in being a consultant, like if you want to be a consultant in the world and you want to be like that ambulatory care consultant to patients,
right?
I think it kind of adds credibility to patients. Like when, this is terrible to say, but like when they see your name and they see all those letters after your name, patients are going to say, wow, this person really must know something. Yeah. So I think it adds credibility to you as you advertise yourself, even to patients.
Awesome. And now you have some MTM stuff you were going to talk about.
That's a good transition.
I'm excited.
So I'm an MTMer, and MTM has been kind of this morphing thing that started years ago, and we have a lot of things in MTM that you guys can use to kind of add to your portfolio of knowledge that you have. So there's the APHA certificate program.
Yep.
So there's differences between certificates and certifications. So
within APHA?
A certification is like what BPS gives you, a board certification.
Oh, okay.
So that's where it gets confusing. So you have to be careful when you're out there looking for getting make sure it'll tell you if it's a certificate program or if it's a certification. So if it's a certification, that's the big one. That's the big one you're going to test for. You're going to get letters after your name. That's a certification. You are a certified specialist in something. Now,
and typically, how long do those last? Is that like...
So the certificates, is that what you're talking about? The certificates are different. So you can take the APHA certificate program and the APHA MTM, I'm talking about the MTM program. You take, it's kind of like the immunization program.
It's like a CE. Yeah.
You take 20, it's like 24 hours of CE.
In a live.
Yeah. So you're going to study, do your modules, and then you have to go for a live, like on a Saturday, an 8-hour live session. So it's just like kind of like the immunization. So after that, right, they give you the piece of paper and you've got a certificate. Yeah. And so you can tell people you have a certificate in MTM, but you don't have a certification, right? Okay. So that exists. There's an APHA certificate in MTM. There's also a Power Pack. And that's a different organization. Right. So the Power Pack, which is a PAK in MTM, the MTM Power Pack modules are really good. They also go through disease states. So they teach you about the different ambulatory care disease states that you would face in MTM. And afterwards, again, you get a certificate. So it's just two different certificate programs. Okay. And APHA, I would say, and I'm sharing this from people I've talked to in the MTM world and what everybody's opinion is, APHA is that certificate program is really good maybe for somebody who's a new practitioner and doesn't have a lot of experience and really is trying to just expand how to talk to patients and how to maybe talk to physicians and things like that in the MTM world. So that'd be good for a new practitioner. If you're a practitioner who's been in practice for a while, you kind of know how to talk to patients, you know how to deal with doctors and how you have to word things. Then the Power Pack is probably better for like a practicing pharmacist who's been around for a while because it goes more into like the disease states and
like guidelines or like why you're reaching out on certain
the things to look for in those patients to ask questions about in MTM. And then now the one thing I want to kind of focus on is there's an MTM certification now. So there is an organization that has promoted an MTM certification. So now we're back to the big things, the big specialists. Now, I've kind of polled my MTMers and the leadership that I know in MTM to say, what is this MTM certification? What do you guys think? Yes. Is it something people should go get? And what are you guys thinking as employers and leaders of MTM businesses? Are you going to require your pharmacists to get this? Like, what do you think about it? So the general sense now is there is an MTM certification that you can get that makes you a specialist, so to speak. And they even say you can put the letters after your name. It is really good in that the benefit of it from people I know who have taken it is it does do the disease states again and kind of gets you into the guidelines and so forth. Yeah.
Okay.
But it really is focused more on the patient.
Motivational interviewing?
Well, I think that's in all of them.
Okay.
Usually we talk about that in all of them. But this is more of like what it's more of the patient side of the thing. What are the patients going to need to know? What are the things you're going to tell the patient about whatever? It's more patient based of like what are those things called, like the asthma, they have to have asthma something plan. Help me.
Oh, I know. What is that plan called?
Action plan or whatever.
Yes.
So it's focused on the patient more so than on you as a clinician, what you need to know. It's like, what do you need to counsel? What do you need to counsel the patient on? So here's my second one.
He's heavier.
Okay. So this is Diesel.
Hi, Diesel. Oh, you are just so
He's
cute.
handsome. His nickname is Handsome Stanley.
Oh,
So he's handsome. He's a nice guy.
oh my goodness.
So say bye.
Are they saying it's useful though, like the MTM?
So they're
certification?
saying they're still waiting because that certification for MTM, their certification, the big one, is not under BPS, and BPS is the most accredited, everybody knows the credibility of BPS. We know how hard the tests are, and so it's hard to give them huge credibility when it's not something that's produced by BPS. And so I think everybody's wanting to just give it more time. Don't let him chew that up.
He was liking
She's letting him chew up my bunny ears. No, go get a chewy treat.
So cute.
You're a good boy.
Oh my goodness.
But I think everybody's still waiting
To see how it pans out.
Yes.
Okay.
It's not intensive. From what I've heard, the test is not that hard, where I can tell you the BPS, Board Certification for Ambulatory Care, is extremely hard.
Right.
So I think the credibility, it's got to be tough in order for something to be specialized and you to say you're a step above everybody. It has to be something you have to prove you're a step above. So it has to have a lot of meat.
Yes.
If that makes any sense. It has to be difficult, or it's not going to be special. But I've heard the test is pretty easy. So that's a good thing if you just want to get it. I mean, it should be pretty easy to get.
Yeah.
And what was I going to say? It's cheaper. I mean, to get board certified, the test itself is about $600. To get the MTM certificate, it was about $300 and something. So it's like half the price of like the ambulatory care specialty.
Would it be 7 years or lifetime, or
From what I can find, it's 5 years. You have it for
Okay.
5 years, and they have to do 50 CEs to maintain
Okay.
it. And
Interesting.
I haven't gotten the answer to the question of what kind of CEs they have to be, if they have to be specialized. So for BPS, they have to be certain CEs.
certain ones?
Yeah,
Okay.
it's very specific. It's just very tough. They can't just be any old CE. So that's sorry that was really long, but for your MTMers, I know there's so many options out there for us of, should I go get the APHA one? Should I go get the Power Pack? I would tell you, I think APHA and Power Pack are pretty online to be equivalent.
Okay.
So that's whichever one you want to go get. I've heard a lot of good things about the Power Pack kind of being meatier and giving you a lot more information to kind of use.
Okay.
But the certification, I kind of still have a question mark there. I don't think the leaders that I talk to aren't really requiring it of their pharmacists. They're kind of, if they want to get it, that's great. It's not something to hire a pharmacist they're going to require or something like that yet. So I think that they're just kind of waiting to see how that's going to pan out.
And it's not really like setting you apart on your application yet.
Not yet.
'Cause it's so new.
Yeah, everybody's kind of really scratching their head about what it is right now and what does it mean. And so I think once that all works out, we'll know more. So enough about that. I just wanted to kind of make sure we talked about that to our MTMers because we have a lot of options for them. Mm-hmm. So besides that, though, and I know I'm talking a lot. Thanks, you guys, because Bryn is really...
It's awesome. It's very interesting.
This is kind of my world. I've been in the residency, board certification kind of world. So thank you guys for listening to my voice so much. But the other option for people, if you don't want to go that far and get a board certification and you don't want to go to get a residency, because that's a big commitment.
Especially
take a pay
people
cut.
that have like been practicing for a while. Like, it's like, okay, excuse me, honey, I'd like to go do a residency. Like, you'd like to go do what?
You want to take half your salary? What, for the next year?
But I mean, sometimes you're in a position where that is possible and that's something you can save up and plan for and go do. But you've got to be very motivated and have an end goal with that. So what are those people who are maybe stuck in their current jobs? What kind of path do you think they should dabble in or explore?
Well, I think you can set yourself apart. I personally think you don't have to you can set yourself apart without doing a board certification and without doing a residency. So to me, you can focus your learning in a particular area.
Yes.
So let's say it's, pharmacogenomics is the new thing and not a lot of people know about it. We're all kind of trying to figure it out. But there are some great programs out there. Some of the universities have programs where their CE department you can go to, and some of the big universities have actually pharmacogenomic CE modules that you can take. Weekends, yeah. So taking your CEs that you have to get for your license, I think, and focusing them in an area, then you can kind of advertise yourself on LinkedIn or as the person you introduce yourself as you're focused on pharmacogenomics and you're trained, you have so many hours of CE focused on that. Yeah. So you can do that.
Fitness. We have like a lot of friends that are into like helping people with their health goals, like getting off medicines, living a healthier lifestyle.
Absolutely. One of the things I'm going to try to focus more on is like the natural ways. So there's a lot of CEs out there on like the supplements and the vitamins, like when are they useful? What are the right doses? So being the pharmacist that has taken the CEs and really trained myself up on when to recommend a vitamin, when to recommend a supplement. I think that you could make yourself kind of that specialist. So I think you could do that in the simplest thing of just focusing your CEs that you're taking for your license into a certain area and then advertising that's who you are.
And adding value, helping change people's lives. That's the biggest thing.
Yeah.
So.
And then you become that pharmacist. So then people are going to know, oh, Bryn knows a lot about pharmacogenomics because we all know that she's taken all those CEs on it. So whenever I get a question on it, I don't know anything about pharmacogenomics. She's going to be my go-to. I'm going to be like, go to her. She's the best. So, it's going to build you up as that specialist that people are going to go to for that topic. And that's going to be good for your brand.
Yes, definitely.
It's going to be good for your brand. So, and I also think one more thing on that, maybe you're interested, like say you want to do a health and wellness clinic at your pharmacy. Like maybe you want to ask your boss that like for 4 hours on a Friday, I want to invite patients to come and talk to me about getting a more natural way to address their whatever, decrease their stress or get off some of their medications, So if you want to build a clinic or a new work opportunity where you work, I think becoming one of these specialists, or the pharmacogenomics is another good example. Say, I want to have so many hours a week that I run a clinic that we really do maybe some testing or invite patients to come talk to me about getting a genetic test. So if you want to make a job for yourself in your current position in that area, I think that's another way is just becoming that specialist in that area.
Definitely.
That'd be a new job opportunity. So I think we're just about done.
Yes. Conferences are good for ideas, generating ideas. You can learn ideas like I can't travel a lot. I've got a family right now. I'm working full time. I'm loving our fun with Heather. So podcasts. I learn all the time when I'm on the road. So always downloading different podcasts. You can search Pharmacy. Pharmacy Podcast Network has over like 700 episodes. So you can pick topics that interest you, that you want to learn more about. You can take CEs, like we mentioned, from the comfort of your own home nowadays. So definitely get involved. Local meetings for pharmacists are a way to network. You just went last Tuesday. I heard it was a very good one.
It was really good. Actually, it was really good. It was really good. And I think I network there a lot too. And that's where you can find people maybe who are doing that specialty that you're interested in and kind of go in that direction. Ask them what CEs to take. Do they need a residency? You can kind of network that way. And on the conference side of things, you mentioned conferences, like focus your conference. There's certain, you have your general conferences like APHA or AMCP or whatever.
Right.
But, there are conferences that are on specific topics of like cardiovascular conferences or, so I think you can pick the conference you go to get that chunk of CEs that you want as well. But like you said, you have to have time and money to do that too. But it's a good way to kind of focus.
Yes.
One of the ways to focus your training too.
Definitely.
Yeah.
Well, thank you guys.
Yes.
It's been amazing.
Yes, we
learning
just want
so
to
much.
Share. Yeah. And so hopefully those of you who had the questions of like, I want to expand my knowledge. I want to do something bigger and different. What should I do? There's so many different options. So hopefully we just shared this with just some ways to think about it and what the benefits of each would be. So hopefully that was helpful for you. And we just wanted to say
Yes.
thank you so
Happy
much.
Easter.
We've really enjoyed hopping around with you today.
Yes. Hop outside of that box.
Hop outside of the box. All right.
Thank you.
Thanks, guys. Bye-bye.
Bye.
See you next time.